How common do you think is PCOS?
So the worldwide incidence of PCOS is about 10 to 12%. That means out of every 10 to 12 women, one or two would be having PCOS. But that's a Western data, and we know that in the Southeast Asian countries, PCOS is more common. Unfortunately, in countries like India, the data is not even available. So we don't have the exact volume of the problem. But if you ask me, I think every third or fourth woman that I see in the clinic would probably have PCOS. So the incidence in India is definitely much, much higher than our Western counterparts.
What kind of unique problems do women face with PCOS during their adolescence, reproductive age group, and menopause?
So during the adolescent phase, girls will have difficulty in losing weight, or they'll start putting on weight very easily. They will probably have irregular periods, having their periods every 3, 4, 5, 6 months as well, and problems with acne. Unfortunately, a lot of these problems happen during the adolescent age group, even otherwise, which is why differentiation becomes a little difficult. Now, in the women of reproductive age group, they could have difficulty in conceiving. The chances of miscarriages are higher in the first 3 months. Once pregnant, the chances of developing gestational diabetes or gestational hypertension or blood pressure during pregnancy becomes on the higher side. Thus, consequently, certain complications like premature delivery or water bag bursting and liquor leaking out, big baby, what we call as macrosomia, sometimes even growth restriction. All these problems can happen during pregnancy because of women having PCOS. Around the menopausal age group, women can have problems with, again, frank diabetes. So type 2 diabetes and essential hypertension is more common in women after the age of 40 because of PCOS. Across the entire age group, you could have lipid abnormalities. So the lipid profile could be abnormal. Excessive body hair, especially in the male dependent areas. Hair fall because of the increased level of androgens in their body. Pimples could happen, of course, at all ages as well. So all these problems can occur. In the menopausal age group, one unique problem which can happen is when women don't have periods for prolonged periods of time, estrogen gets secreted in excess. And we know that excess estrogen being secreted for prolonged periods of time can increase the risk of uterine cancer. So women with PCOS have a higher risk of developing uterine cancer as well, especially those who have delayed periods. Along with this, something that we never spoke about earlier, mental health issues are far more common in women with PCOS now, or at least so we've discovered. Along with that, sleep issues. Again, we never thought we would associate sleep with PCOS, but sleep disturbances are also now found to be more common in such women.
How do you look after adolescent PCOS?
So I think adolescent PCOS girls or women are little more difficult to diagnose. We've discussed this earlier as well. I think the primary focus has to be exercise and diet, lifestyle changes. If there is PCOS, you need lifestyle changes. If there is no PCOS and she's having irregular periods, weight gain, difficulty losing weight, you're again going to start with lifestyle changes. Along with that, of course, based on the investigations and based on the unique problem that that girl probably would be having, we do use oral contraceptive pills, and they can be used in the adolescent girls also. We do use a lot of metformin as well, where specifically indicated. But the focus primarily in this age group is always lifestyle changes.
What advice do you have for someone with PCOS and wanting to conceive?
So there is a growing importance of preconception counseling, that is going to a doctor even before you've actually conceived or even thinking of conceiving, so your unique problems can be identified and rectification or control of those problems can happen. And women with PCOS should definitely visit a doctor. Why? Women with PCOS have more thyroid and prolactin abnormalities, both of which can cause subfertility problems. They may be having excessive weight. They may not be ovulating. They may not have regular periods. So all of these things can be looked after by your gynecologist or your fertility specialist. Of course, it all starts with lifestyle changes all over again. But along with that, certain unique, characteristic and very effective medicines and therapies can be started for such women if they're having difficulty in conceiving.
Pregnancy with PCOS. What should the doctor and patient watch out for?
So, a woman with PCOS conceiving and getting pregnant presents certain unique kind of problems. So both the doctor and the mother herself have to be very vigilant. At the beginning of pregnancy itself, it's very important to look after thyroid values for every pregnant woman, but especially for someone with PCOS, because in such women, as I said, thyroid abnormalities are more common. You must test for sugars. Again, how do you test for sugars? Simply doing a fasting sugar or doing an HbA1c is not going to be good enough. You have to do more specialized tests like a spot test with 75 grams of glucose to pick up a unique problem called glucose intolerance. So that's what the doctor needs to do. At the end of 3 months or even in the first 3 months, you need to put this patient onto a nutritionist because her diet needs to be very, very carefully planned so that she does not put on more than 10 to 12 kilos. And if she's putting on more weight than that, we can identify at the earliest that a problem might be occurring and we start making corrections. From a patient's perspective, I think she needs to be very vigilant about her diet, and the moment the first 3 months are completed, get into an exercise program. Exercise is going to be very, very important to make sure your sugar levels are being maintained. I do understand that all pregnant women will have cravings, the ice creams and the chocolates and stuff like that. But especially if such pregnant women also have glucose intolerance, they cannot give in to these cravings, at least not all the time. And they need to work very closely with their nutritionist to understand what can be had and what cannot be had. If there are cheat meals, they need to be balanced maybe with exercise or maybe with medications.
Advice for someone with PCOS in their menopausal age.
I think the simple answer would be something that I keep screaming from every treetop possible: annual preventive health check programs. So there should be a certain set of investigations, blood test, ultrasound, pap smears, breast cancer screening, all that every woman should undergo maybe after the age of 30, but definitely after the age of 40. And you can actually pick up small little problems at the earliest and nip the problem in the bud itself. So since we know that menopausal women or perimenopausal women with PCOS can have diabetes issues and blood pressure issues and cholesterol issues, all of this can be picked up very easily in the blood tests. We spoke about uterine cancer as well, again something which can be picked up through history and an ultrasound examination, and of course further tests if required.
What is insulin resistance and how does one test for it?
So insulin is secreted by the pancreas and that allows the glucose to move into the cells. Now in case you have insulin resistance, there is a lot of insulin, but it's not being able to push the glucose into the cells. Thus, the glucose levels are going to rise and the insulin levels are also going to be rise, something which is very, very characteristic in women with PCOS. And of course, the more obese you are, the more is your insulin resistance. So all of it becomes a huge vicious cycle in women with PCOS. Now, earlier and even now, there are various misconceptions regarding how insulin resistance needs to be tested. Some do fasting sugar, some do HbA1c, some do a fasting sugar to fasting insulin levels. All of this has been conclusively shown to be an absolute waste. We know that because of insulin resistance, sugar levels are going to go up, but not to the diabetic level. Such women, only when you give them a glucose load or a glucose challenge, are they going to shift to the diabetes level. Thus, a screening test with 75 grams of glucose needs to be done. That is, empty stomach, take 75 grams of glucose, do not eat anything for 2 hours, and after 2 hours give your blood value. It should be less than 140 milligram per dl. This goes for adolescent girls, women who are trying to get pregnant, women who have gotten pregnant, and women in the later age groups as well. This one screening test is going to tell you if you have glucose intolerance, and that glucose intolerance is going to come from insulin resistance.
What is the role of Metformin? Can it be safely used by women who are trying to conceive or are already pregnant?
So Metformin is an insulin sensitizer. Now, I've already said insulin resistance is one of the biggest problems in PCOS. So if you give an insulin sensitizer, a lot of the problems of PCOS will get reduced. So women actually tend to lose weight, have more regular cycles, get pregnant faster, reduce miscarriages. So definitely metformin is a brilliant drug, reduces the glucose problems as well, and it's absolutely safe to take for women who are trying to conceive. So much so that even women who are pregnant can be given metformin in the first 3 months to reduce the incidence of miscarriages, and they can be given this metformin even after the first 3 months so as to take care of the glucose intolerance. So women with gestational diabetes sometimes are given the first line medicine, metformin, to control their blood sugars along with diet and exercise.
I have a friend, 30 years old, who was diagnosed with PCOS on an ultrasound 2 years ago. And then with treatment, the cyst completely vanished when she did the scan again. We do see a lot of claims of PCOS cure on social media. What is your take on that?
PCOS is most likely a genetic problem. You're born with it and you'll probably die with the problems of PCOS. It never actually goes away. You can't cure PCOS. Yes, you can through various lifestyle modifications, medicines and everything else control PCOS. So I don't think the claims made on social media regarding cure of PCOS are correct. As to your friend who had PCOS or who was shown to have PCOS 2 years ago on ultrasound, as now being shown that she's completely cured, is again wrong. It is possible that A, the person who did the scan earlier was able to see the PCOS. For whatever reason, the second sonologist who did the ultrasound could not properly perceive the morphology of PCOS on ultrasound. Could be that she has gas, constipation or some other problem during the ultrasound on the second time. Number one. Number two, if someone actually cannot see the PCOS morphology, where it was seen maybe 2 to 3 years earlier, I'm not actually happy. I'm worried. In a young woman, how do you see PCOS on ultrasound? You do a vaginal ultrasound or maybe an abdominal ultrasound, although the vaginal is preferred, and you see a ring necklace of small little cysts in the ovary, which represent the eggs in that woman. And that is how, in a typical fashion, you say that this is polycystic ovarian morphology. Now, after 2 years or 3 years, that morphology is not being seen. What does it tell you? It tells you that the woman is rapidly losing her egg numbers. And those egg numbers have gone down so significantly that on scan, you're not being able to see the polycystic ovarian morphology. So I'm not actually happy. I'm worried for this woman, especially if she's not already had babies.